Namaste and welcome to the next episode of Clinical Ayurved. Myself, Dr. Mayuresh Agte. We were discussing diseases of Pranavasrotas, and in last few episodes we have discussed Shwas Vedi as such and Shwas as a Kulaja Vedi. I have put forward my view about Shwas as a Kulaja Vedi, and on that background research in Ayurveda in today's era. So, after discussing the Shwas Vyadi, we will move towards the next Vyadi, and it is Pratishay or Penasa. Now, for diagnosis, it is very simple, everyone knows. For the treatment, it is also easy. Tribhum Kirti, Paritakuti, Tarisadi Churna, steam, etc. Then, if it is simple to diagnose, if it is simple to treat, as we all know, then what is the important clinically in today's practice? Let us discuss this point in today's episode. As we know, for diagnosis of penis or pratishay, there is no rocket science. Patient tells you running nose or choked nose, sneezing. Sometimes there is the heaviness in the sinuses. All of you know, and treatment again Vatakafagna, Shwas Kuthar, Tribhum Kirti, Paritakuti, Tarisade Churna, Pipali, Kantakari, Dhumapan, or steam of warm water, etc. So, symptom wise, easy to diagnose, treatment wise, easy to deal with. Then you will ask me what is the purpose of this episode if everything is simple. As I said, everything is simple to diagnose and to treat. Then, in today's practice, in as far as my experience is concerned, what is important in treating the pratishay or penasa is diagnosis of hetu, because many a times unless you deal with the hetu parivarjan, the treatment will be symptomatic and patient comes to you often and often with the same complaint. So let us discuss, when we are treating the penasa, how important the hetu are to have a complete and a good treatment. So let us start with the hetus in clinical practice. So first is Aharaja hetu, and in Aharaja hetu, if a person tells you that I have got a recurring sinusitis and I am fed up of that, always ask about the cold food, specifically cold water or cold drinks. Nowadays, many a times people are in the software or in the companies, they have some provision of such things of cold water, cold drinks, etc. And the person has got a habit to drink such things often. Second hetu about the cold food is the food kept in the fridge. Nowadays everyone is working, so many a times a morning food or is kept in the evening in the fridge, and that is taken as a food, or frozen food is the another hetu which is seen in the practice. So always ask the patient whether he is eating the cold food, cold water, cold drink often. This is the very much common cause, and you have to convince the patient that you have to keep these things away and have a hot food and hot water. Second hetu, which is far more important, is Viharaja hetu. And in that case, the prominent cause you will see in the patient is the working in the air conditioned environment. Nowadays, in the companies or in the offices, there is a centralized AC, and the person has to work there for say 8 to 10 hours constantly. And because of the centralized AC, constant air currents are going through every respiration, and this is the far most common cause seen in the patient. So you have to ask the patient if the air condition is individual to its cabin, make it off, or at least adjust your chair if it is a centralized AC in that way that you will find a minimum current of the or cold currents of that air. I will share you my experience of a patient. He was having a chronic sinusitis. After medicine, he used to get upashama, but again, after some time, he used to come with the same complaint. When I asked with this hetu, he said that I have to work in the company, and it is a centralized air condition with a very low temperature, and my sitting position is rightly in front of that air condition in the office. So I asked him whether you can change the seat or your positions. He said there is no chance of changing my position, and I had to deal with these AC currents constantly for 8 hours. So I asked him, so yeah, there is only one choice to at least reduce this effect of air condition, that you used to use the scarf, or a better choice is a muffler, which is a thick one. He said, sir, you are right that uh, this is the only choice to prevent this AC current, but what people will think? I just asked him, see, you are suffering, not the people. Now it's your decision. If you are thinking of people, then you have to suffer unless you are working in that place. And change of job is not so easy in today's period. He said, okay. He started using muffler or a scarf, a thick scarf during working, and he didn't bother about what other will say. You will surprise, after 15 days he came to me. He was relieved because of that scar, but he told me an interesting thing, that sir, when I started using this scar, in first I was also hesitated that what people will think, but you will not believe, after 15 days almost everyone in the office has started using this scarf. So the problem was to all of them because of this air condition, but everyone was hesitating just because what people will say. So avoiding the AC is the major thing you have to think of. Avoid of the fan, especially in the sleeping. People have addiction of fan. Throughout in summer season it's okay, but some have addiction to put AC throughout the night, or to use fan on the high speed throughout the night, and many times it is not necessary. So ask the patient, if the fan is working throughout the night or throughout the day, at least you can make the speed low, or at least uh, try to sleep just away from the direct currents of the that fan, sorry. See, these two things are very important because they help very much to reduce the intensity and need of the medicine. Third important factor as a in the Viharaja Hetu is using a scarf or a better helmet during driving. Because of the pollution in the air nowadays, and the pollution is increasing day by day, this pollution interferes with the nasal mucosa, and people get constant pratisha or penis. The people who have to have marketing job have to travel much more on the two wheeler, and they don't use car. They must use the helmet or at least car to prevent this sinusitis or penis or pratisha. The after this Aharaja and Viharaja Hetu, always examine the patient nose thoroughly, because when there is recurrent sinusitis, you will always find deviated nasal symptom in many patients, and because of that deviation, there is blockage in the air entry or air passing in the expiration, and because of that blockage there is constant friction in the nasal mucosa internally going by every breathe, and the mucosa gets swollen. So, if there is DNS, you have to ask the patient to take the steam regularly, in spite if they don't have any symptom. Then also the steam is important, because accumulation, the gradual accumulation of the mucus gets vanished because of the steam. And then you can use medicines with nasya like Panchandri Vardhan Tel, Anu Tel, Vacha Tel, what you prefer according to the patient's symptoms. So, in today's practice for penis or pratishay, always remember, unless and until there is Hetu Parivarjan, the treatment will not be sufficient, or it will not be 100% successful. And these are the common symptoms of Hetu which I discussed in today's episode. Thank you very much.